I did want to ask you about the Women's Health Initiative at Mind. It's mentioned in
Yeah.
your abstract as something that you guys are looking into or sort of
Yes.
expanding into.
Yeah.
So please share about that and sort of what conditions you're looking at there.
Yeah. WHIM, or the Women's Health Initiative at Mind. I just wanted something that was catchy where I could say, not just a whim. Over a
You're
billion,
always with the puns. I
I,
love
I try, I really
it.
try. Over a billion individuals are affected by things like gynecologic pain in this country. It's largely understudied. This is an underserved population for a million different reasons. And there are lots of reasons to explore the potential application of cannabis and cannabinoids in these conditions. For example, we did a number of survey-based studies. These were my first real survey-based studies. I had done a little bit of work in this area before, but in women with perimenopausal, menopausal, and postmenopausal disruption, and things like cannabis or cannabinoids, we did a survey study that was a bit of an adjacent clinical investigation, individuals who are using a commercially available vaginal suppository for menstrual related dysfunction. And we now have our very first project that's funded to look at women with endometriosis using a whole plant full spectrum product that I made for folks with endometriosis and related pain. So there's a lot of interest here, and
Mm.
people are using these products. The problem that I often hear about is patients will tell you, I don't know, my friend used this, so I figured I'll just try. Well, wouldn't it be great to actually have data that could help individuals be informed about what products they should and maybe shouldn't be exploring? I don't know, just a thought. So that's I think a rather exciting area. Again, endometriosis is one of those conditions that so many are affected by. So many are affected by.
Yeah.
And the number of symptoms is rather staggering when you really start looking at the data. And so if you can improve the quality of life and you can reduce discomfort and increase people's ability to sleep and be less, again, either less anxious or have less pain or all of the above, why wouldn't you try?
Mm. No, it's interesting you mentioned endometriosis. We did have a presenter last year who talked about that, and it was sort of more exploratory of, could cannabinoids potentially be a good
Yeah.
treatment option? And it sounds like now you're actually investigating that. So that's fantastic.
There's every reason to think so, given the relationship between the endocannabinoid system, this endogenous system, chemicals and receptors throughout the brain and body, and the gynecologic system, right? So again, when we think of the ways that we're all sort of wired, why wouldn't you try to harness the most powerful things that you could that are potentially less invasive or less, quote, disruptive to other things? If it isn't likely to do a ton of harm and could potentially help, I'm all for trying to see what we get. So.
Excellent. All right.